In this video, we are going to go over applying for a regularly scheduled series through continuing nursing education at Northwell Health. We will go over from start to finish, including application as well as expectations after your initial application and throughout the entirety of your program. So as you can see on the screen, this is the CNE pre-application. This will be the first part of your application, and this must be completed in order to have access to the rest of the application. As you can see here, it does say we kindly request that you submit your program application 60 days prior to the start date of your program. We do expect that the pre-application is at least initiated 60 days prior to the start date, if not discussed with us prior and receiving an exception. As always, if any questions or concerns, you can reach out to us at nursingconferences@northwell.edu. Something to specifically keep in mind for regularly scheduled series is that you always need to receive approval through continuing nursing education to apply for a new RSS program or series. Also, something to keep in mind for RSS programs is that they must have start dates that are either January, July, or September. They are not allowed to initiate any other month of the year. So let's get the pre-application started. First, you will put general information about your program as well as your information and the facility. Then we are going into program type. And the first question that it asks you is the program interprofessional, nursing plus one or more other professions, or uniprofessional, only nursing? My program is uniprofessional, and as many of you know, this application is strictly for uniprofessional RN credit. But let's see what happens when I select interprofessional. So it will ask, if I selected interprofessional, would I like to apply for credit for the other professions? It then provides me with a list of what we are allowed to apply for through joint accreditation. Please keep in mind that in order to apply for credit for another discipline, that discipline or profession must be represented in the planning committee as well. Therefore, if I would like to apply for MD and DO credit, I must have had to ensure that there was an MD or DO a part of the planning process of this program. If they were not, or if you do not have an MD or DO listed, you cannot apply for credit for those professions. So now say you do want to make this interprofessional, but you can't and you don't meet the expectations of applying for these other credits for the other professions. So I'm going to select no. It will say here that you can invite additional professions that you think may be appropriate to include in the target audience of your program. So you can select any of these options. They will receive a certificate of completion. They won't receive credit through their accrediting body. However, they will still receive a certificate for coming to your program. So let's see if I did select yes to apply for credit for other professions. It would notify me to stop here and that the application is strictly for nursing credit only. It would direct you to contact us if you would like to apply for interprofessional credit, and we would then direct you on how to do so. But let's go back. As I said before, my program is uniprofessional. So I'm going to select uniprofessional, and I think it's appropriate for all RNs. However, I could make it more specific. If I feel my RSS program is more appropriate for just NPs or RNs in specific specialty areas, I can designate that here. Now we are going on to type of activity, and this is where we are noting that this is a regularly scheduled series. So as a reminder, a regularly scheduled series is a course consisting of multiple independent, unique, ongoing sessions. So examples of this include grand nursing rounds, tumor boards, morbidity and mortality conferences, journal clubs, etc. A single program that is repeated multiple times is not considered a regularly scheduled series, and live activity should be selected. So it also notes here, as I said before, you have to contact nursing conferences at Northwell EDU to obtain approval to proceed with the application, and that RSS programs can only have January, July, or September start dates. So I've selected regularly scheduled series. I have indicated whether it's in person, virtual, or both, as well as including my virtual platform and how my participants will register for the program. For the start date and end date of the program, you are going to indicate the first offering that you will be providing this program. So I plan on starting this program on May 1st, so I indicated that here. My start time and end time is 3 to 4 o'clock. So I've indicated that here. And I've also titled the name of my series. Some individuals with RSS programs, it is different than the activity title that they put at the top of this pre-application. If it is the same, then you can simply put the same. It will then ask you for frequency. The frequency can vary. You can offer it as often as you would like to and however you had planned to. It offers you for weekly, monthly, or quarterly, and you can indicate other if it will be something like bi-monthly or bi-weekly. You will then upload a tentative schedule for your RSS program. So we understand that these dates may change throughout the year. However, just give us a schedule that we can kind of visualize when your program is going to be offered. Again, this is tentative. It does not have to be your formal and final schedule. Then it will ask you, is this program non-clinical? Non-clinical programs include programs like leadership, communication, skills training, things of that sort that have nothing to do with the clinical setting or applying clinical care. If your program is clinical, you will select no. If your program is non-clinical, you will select yes. If you are unsure, please reach out to us before moving forward, because based on this selection, it will change your application going forward. So I selected no because my program is clinical. So let's move on to disclosure forms and contact information. You will have to list here all individuals involved in creating, reviewing, or speaking for the program, including but not limited to course directors, planners, teachers, speakers, authors, writers, reviewers, or others. And please include yourself in the list. You will notice here the only exemption from uploading disclosures is if your program is non-clinical. So if my program were non-clinical, you see here that there is a place for me to upload a disclosure form for the one individual that I'm listing. Had I chosen non-clinical, you will not be expected to upload disclosure information because per JA, that is not required. However, if the program is non-clinical, it will still expect you to list all of the individuals involved in the program. You just won't have to upload disclosures. For my program, it's only me, myself, and I as the course director, the teacher, and the writer. So I just selected one, and based on the amount you select, it will populate those fields for you. It will ask for full name, credentials, email address, and the roles. And like I said before, my program is clinical, so I was required to upload a disclosure form. I am now ready to submit. And once submitted, it will say, thank you for your application. The CNE team will review the pre-application and will grant you access to the remainder of the application. If any changes need to be made, the CNE team will contact me directly. So I have just received notification that my CNE pre-application for my RSS program has been approved, and I now have access to the application. When you first open your application, the first question and section will be professional practice gaps and outcome measures. So the first question it asks is, in a maximum of 50 words, provide a statement that summarizes the professional practice gap that this program aims to address. As you can see above, we provide you with examples of professional practice gaps and an example gap statement. If you are not familiar with writing gap statements, please utilize this example as a guideline as to what should be included in your gap statement. You will then move on to select all that apply, and this is strictly designating what evidence you have that validates that that professional practice gaps exist. You will then move on to state the educational needs that you determine to be the cause of that professional practice gap. What is missing here? Why is there that gap? So you have the options of skills strategy, performance, or other. As you select these, you will receive a coordinating box that further asks you to describe that need. The next question, and here is what ends your outcomes and professional practice gaps section. Which of the following types of results will this activity address? Basically, what this question is asking is the program is designed to change ... and you are expected to check all that apply to your program. As you select in There will be a box below that states in 50 words or less, state what you intend to specifically change in terms of what you selected above. So you'll put a generalized statement that includes everything you selected up here. Then we will move on to two sections that are specifically provided to us by joint accreditation. The first one is indicate which of the following core team competencies as developed by the Interprofessional Education Collaborative that will be addressed in this activity. And here you can select all that apply. They are all very general and broad. And then next we will select two pre-prepared learning objectives from joint accreditation. Again, these are very broad objectives, but we expect that you select two that can apply to your program. Now let's move on to, again, more program-specific information. You will then have to provide two specific objectives for your RSS program. An example of an objective is provided for you. The example is participants will be able to identify risk factors for UTIs. You will provide two learner-specific objectives for the entirety of your RSS program. What are the objectives of your RSS program for the learner? This can confuse people, and some individuals will put objectives for the teacher or objectives for the instructor, but these are specifically learner-geared objectives. You can utilize Bloom's taxonomy and Google Bloom's taxonomy in order to receive specific verbiage that may help you put your objectives together. Now we will move on to your lesson plan and agenda. As I know, this is an RSS program and the content will be changing from month to month. However, the timing should be the same each month and what you will be covering should be the same in terms of timing. So for my program, I did make it a 1-hour program for each of my sessions, and I just simply put the intro to each session up here, and that is always going to be 10 minutes. And then my second topic is my content, and that will be 50 minutes. Now, this is very broad. For an example, say you have a journal club, you can simply put intro to the journal for your 10 minutes, and for the remaining 50 minutes, or you can break it up however you want, discussing the specific monthly selected journal. You will put here whatever applies to your program, whatever you will be covering, and what your agenda will look like for each offering. You are able to put up to 10 topics here, so please, I know that you do have the ability to make a very lengthy program here. And also note that we are putting the amount of time in minutes. And note that I have not written the word minute, I just simply put the time. The reason being is because REDCap is automatically going to calculate my contact hours for me. So I've slid down to live contact hours. And as you can see, the live contact hours for my program is 1 contact hour. So let's discuss this number if it does not come back to you as a whole number. So as you can see, above, this had calculated to 0.92 contact hours. That is not a number that we are able to provide to our participants. Through joint accreditation and ANCC, all credit hours or contact hours have to be rounded to the nearest 0.25, 0.5, 0.75, or whole number. And you must round down, not up. So let's look at some examples to clarify that information for you. So say my program calculated I have 6.83333 contact hours. I am rounding that to 6.75. If I received 1.45, I would have to round down to 1.25. 3.6888 would have to be rounded down to 3.5. You will not have to think about this. Majority of our RSS programs do fall as whole numbers or on that 0.25, 0.5, or 0.75 mark. But please, if it does not, note here how you should calculate your hours. If you are confused or unsure, please reach out to us and we will clarify for you what your contact hours will be. This way you can complete the required documentation correctly. So you will be required for your RSS program to attach your agenda as well as a slide deck. This agenda can simply be the first offerings agenda. And let's look at what is expected in your agenda. So we do provide you with a template. If you have already created an agenda, please feel free to use your own template as long as you include all of the required information that it shows on this template here. Your program title, the agenda, and the date, the location, the time of your program, the learning objectives, your agenda details, and then the disclosure policy disclosures, joint accreditation statement, and credit designations. As you can see here, we do provide you with all of the required verbiage. All you will have to include is the listed disclosures with credentials, as well as your contact hours. As I said before, if my RSS program was non-clinical, it would not be required for me to submit disclosures. So this verbiage is going to be different and the disclosures are going to be different. That is not something you have to be concerned about. Depending on how you've identified your program, whether it's non-clinical or clinical, you will be provided with an agenda that has the correct verbiage for you. So if it was non-clinical, this would be gone and it would simply have a different statement in the disclosure policy. Again, not something you have to be concerned about. You will be provided with the correct verbiage. You will then list 2 of your references in APA format below. And now let's look at our slide deck. Very similar to our agenda, very straightforward. You'll put the title of your RSS program. You can put the date of your first offering, or you can put how often your RSS program is going to be held, whatever you choose. You will then select the second slide and put in your credit hours or contact hours, and then your disclosure policy slide. As I said before, if this program was non-clinical, you would be provided with the appropriate verbiage, the appropriate template for a non-clinical program. For a non-clinical program, you would not have to list any disclosures, and the disclosure policy would be provided up top. So I myself have uploaded my RSS agenda as well as my RSS slide deck. And now we move on to our references. It is a joint accreditation requirement that you provide at least 2 references for your RSS series. You would put those in APA format in the reference 1 box and reference 2 box. As you can see, I have done so here. You are also required to upload a copy of that reference. So I have uploaded both of my references. Please also try to ensure that these references are current. We want to make sure we are providing up-to-date education to our nurses. So as you can see here, I've uploaded that PDF of my reference just so you can take a look at what it will look like. You can also upload simply a link, but we do prefer that you upload a copy of the journal. You will then notice you have the opportunity to upload 3 and 4. Don't feel the need to upload more references unless you have used more references for your program. You are required to only upload 2, so if you want to simply list the remainder of your disclosures, please feel free to do so. In the reference 3 box and reference 4 box, you will be able to add as many references as you so please, so there is absolutely no limit there. And again, please do not feel pressured to upload 3 and 4. As long as you have 1 and 2, then that covers you. So now criteria of awarding contact hours. All C&E programs require a submission of an evaluation form to receive contact hours that is distributed by the C&E team. So as many of you know, when you submit each roster, we distribute an evaluation form to all of your participants, and upon completion of that evaluation form, they are awarded their contact hour certificate. So baseline for all of our nursing programs, we always require a submission of an evaluation form. It is a requirement. However, what this is asking you is, are you going to have any additional criteria for your RSS program in order to award contact hours to your participants? So in my case, for my RSS program, I am stating that successful completion of a post test, AKA the attendee must score a certain percentage or higher on a post-test for each of my sessions. So I have selected that here. Other options are successful completion of a return demonstration or attendance at one or more sessions or attendance for a specified period of time, etc. So these are more if you would like to provide any more limitations or criteria for your participants to receive contact hours. Just know that a general baseline requirement is a submission of an evaluation form that we, the C&E team, take care of for you. You will then provide revenue details if there is revenue for your program, and then the follow-up outcome evaluation method. Joint accreditation requires a follow-up or outcome evaluation after your program. As you can see here, for RSS programs, these are required at the 6-month and 12-month mark of your RSS program. So these are done less frequently than many of our other programs. This will assist you in decreasing the amount of work you are doing. So we are allowing you to select what your follow-up evaluation will be, what you are going to use to measure your outcomes. So we've provided you with a bunch of options here: self-reported change in practice, focus group, change in quality outcome measure, observation of performance, or other. And it describes what would be expected for each. If you select self-reported change in practice or focus group, it will provide you with a survey that you can utilize as a baseline for what you will be distributing to your participants for that 6 and 12-month evaluation. And as you can see here, I have selected self-reported change in practice. So therefore, I will be saving this so that I know I can distribute it to my participants at 6 months and 12 months time. Just note that when it is time to submit your evaluation, your 6 and 12-month evaluation, you will receive an automatic email for you to submit that documentation via REDCap. So now we are almost done with our application. We now need to provide attestation to the following: to be in compliance with ACCME standards for integrity and independence in accredited continuing education. So you will simply read each statement and agree. And now I am complete with my application and I am submitting. So it says, thank you for submitting your application. The C&E team will review it and I will receive an email upon approval of the program. If any changes need to be made, the C&E team will contact me directly. And I can always reach out to the C&E team if I have any lingering questions about my application. I just received notification that my program has been approved, and this is exactly what your approval email will look like on your end as well. So it states the title of the program, the course number or code that it has been assigned. Please keep in mind that that course code does not change. It gives you the assigned contact hours, and it tells us the dates in which we can run this RSS program. Just note that in 1 year, updated documentation must be submitted in order to continue running this program, but we will discuss that in a moment. RSS program additional applications. You will receive access to submit additional applications needed for each offering of your RSS program. Please ensure these are submitted in a timely manner for the C&E team to review and approve. The additional applications will require you to upload an updated agenda for the upcoming session, as well as any additional disclosures required. Keep in mind that those additional disclosures are only needed if your program is clinical. Please ensure that your agenda reflects the appropriate individuals for that offering in the list of disclosures if you have a clinical program. Agenda and slide deck. It is a joint accreditation requirement that the agenda and slide deck with the required verbiage is utilized for your program. If for any reason there were changes needed to be done on your submitted agenda and slide deck on your application, the C&E team will edit them and you will receive new versions in this approval email. If you do not have new versions that were uploaded by the C&E team, that means you may utilize the versions that you have uploaded in your application. Rosters and certificates. After your first RSS session, You will fill out the Excel spreadsheet attached, the roster template. You will receive an email on the start date of your program that will invite you to a REDCap survey to upload and submit your roster for that session. Once submitted, an email will be sent to all of your participants with access to an evaluation form. Upon completion of that evaluation, all of your participants will receive a certificate. You will receive additional links to upload rosters for your future sessions. If for any reason you are missing one and need to upload a roster, please email us and we will get one to you. Educational material. It is a joint accreditation requirement that educational material is submitted for all programs. This could be slides, in which PDF format is fine, copies of handouts that you provided to your learners, anything that you feel is appropriate as educational material. You'll be able to upload this educational material when you submit your first roster. Follow-up evaluations, just a heads up, you will receive an automated invitation to submit the 6-month and 12-month follow-up evaluation for your RSS program. If you have questions about that ahead of time, please feel free to reach out. And then last but not least, expiration. It gives you the expiration date and is letting you know that the approval will expire. All RSS programs are required to submit content review and updated information 1 year after initiation of the program in order to continue offering it the second year. Additionally, all clinical RSS programs will be required to upload updated disclosure forms. 45 days before the 1-year mark of this program, you will receive an invite to submit the required documentation. Once submitted, the CNE team will review it and you will be notified of approval to continue offering your program. If you do not submit this form and if it's not approved, you will be unable to continue offering this program and future RSS applications and rosters will not be approved and processed. As always, if there's ever any questions or concerns, you can email our team at nursingconferences@northwell.edu. So it's the date of your first session, and REDCap has automatically emailed you saying congratulations on hosting your program with the program name and your course number. It will ask you to access the survey to submit your roster as well as the educational material for your program. So you'll be able to select on this survey, and let's see what that will look like. When I open it up on REDCap, this is what the survey will look like on your end. You have the general program information up top, gives you the title, who requested the application, and their course and the course code. Then it will ask you to upload your roster. It provides you with the roster template here in case you do not have it, although you will receive it upon your approval email, but it is here just in case. So you'll upload your roster from that session, and it will also ask you for your first RSS session for educational material from your program. So this can be the PDF of a PowerPoint, any handout, a copy of it, anything that you utilize for that first session of your program. And then I have now uploaded my presentation as well as my roster, and I am ready to submit. And then it states, thank you for submitting the required documentation. Your participants will receive an evaluation within 3 business days. Upon completion of their evaluation, they will be automatically awarded their contact hour certificate. After you have received approval for your RSS program on our main application, you will also be sent not only the approval email, but an invite to a follow-up application. You will have that link readily available to you so that you may apply for your next session for your RSS program. We do not require that you complete a full pre-application and application in order to host each RSS session, but it is an expectation and requirement that these follow-up applications, which are condensed and should be fairly quick to complete, are submitted for each of your sessions, and it must be approved in order for you to host and offer credit for that session. As you complete these follow-up applications and are approved, you will continue to get new link invites to this follow-up application. We want you to have it so that when you are ready to complete it for your next session, you have it available to you. However, if it's been some time you're missing the link, please reach out to us and we will forward you another invite to your next follow-up application. Please do not try to click on a past link that you've already submitted a follow-up application for, because that link will no longer work. It is a requirement that you get a new link each time for each session. So I am now filling out my follow-up application for my RSS program. I hosted successfully my program in May, and I am ready to apply for my June session. So I open up the follow-up application, and at the top is general program information. It will then ask, what day will I be hosting this session? So I've indicated my June date here because my session is monthly. And then it's going to ask, is my RSS program a journal club? My program is not a journal club, but if it were, I would select yes here. And then it would provide me with the Journal Club worksheet, and it will state to attach our most updated worksheet below. So let's take a look at what the Journal Club worksheet looks like. You are simply just putting the date of your RSS program and the article information in terms of what you are looking for and what you've used for that session, including your faculty and educational objectives if you had any specific to your article that month. You would then be expected to upload that updated Journal Club worksheet for each session. My program, again, is not a journal club, so let's go back and select no, and as you can see, that upload has disappeared. It is then asking me to upload my agenda for this next session. I have to make sure I include objectives and references in the agenda and update the disclosure information with the additional names for this offering. It also states that please feel free to utilize your first agenda as a template if that is easiest for you. For many of our programs, it probably will be easiest for you to just work off of a previous agenda. However, we also provide you with the appropriate template here, and depending if your program is non-clinical or clinical, you will receive the correct agenda. Your objectives can remain the same if you feel that your broad objectives from your application are applicable to your program, or you can specialize the objectives for that month or that session rather. So I've uploaded my new agenda for June. And now it is saying that please note that all course directors and planners do not need to resubmit disclosure forms for this session, as you have already submitted disclosure forms for this RSS program on your application. What this section is asking is to upload any additional disclosures needed for that monthly session specifically, any new planning committee members, speakers for the session. And if you do not need to submit any additional disclosures, you can disregard the submission below. You have a copy of the disclosure form provided to you here, and it will ask you to indicate the additional individuals that you will have to upload a disclosure form for and will be involved in this session with their credentials. So for this session, I do have two guest speakers. I have John Doe, MD, and Jane Doe, PA. So I have two additional people that I must add. And remember, these people should also be added into your disclosure section in your agenda if your program is clinical. So you've listed them here. You will indicate the number of disclosure forms you will have to submit. I have two people, so I've selected two, and I have uploaded both Dr. John Doe and PA Jane Doe's disclosure below. I have now completed my follow-up RSS application for this session in June, so I'm going to hit submit, and it says, thank you for submitting the documentation for your upcoming RSS program. The CNE team will review the documentation and will notify you of approval status. So now we are going to discuss submitting your additional rosters for your sessions for your RSS program. On the date of your next session, you will receive a link to upload your roster for that session. When you click on that link, it will bring you to the REDCap survey that will look like so. At the top, you'll see general program information, and then it will indicate the date of the session. We will populate that date for you based on your applications, so we will know what session this is for, which is why you were able to receive this invite on the day of that exact session. So the date will be completed for you. The roster template will be provided for you again in case you do need it, and then you'll be able to upload the roster from your program for that session. I've now done that and I'm hitting submit. And then it states that my participants will receive an evaluation within 3 business days, and upon completion, they will be automatically awarded their contact hour certificate. So it has now been 6 months since I initiated my RSS program. On that 6-month mark, I have received an invite via email to upload my 6-month follow-up evaluation. This will be automatically sent to all RSS planners at 6 and 12 months. So I've opened up my 6-month follow-up evaluation. At the top, it gives me general program information. Then below, you will notice we have all of the different options of follow-up evaluations with the criteria expected. We did provide these directions on the application. However, they are repeated for you here in case you forgot or need further clarification. Also note that if you chose self-reported change in practice or focus group, we are able to provide you with a survey template that 1 could either guide your focus group, or 2, you can distribute as your self-reported change in practice survey. We suggest you utilize this verbiage if you are utilizing self-reported change in practice. However, if you would like to add any additional questions because you would like to capture more information from your participants that are very specific to your program, please feel free to add any questions to that evaluation. So I chose self-reported change in practice myself. So I've already surveyed my participants from the last 6 months, and I have collected that data via an online survey. I pulled the report and I have uploaded it here. So now that I've uploaded my 6-month follow-up evaluation, I will hit submit. It then says, thank you for submitting the 6-month follow-up evaluation for your program. As I said before, this will also occur at the 12-month mark. So at the 12-month mark of your program, you will receive an invite for the 12-month follow-up evaluation. And when you open it, it will look like so. It looks exactly like the 6-month follow-up. And you will upload your 12-month follow-up evaluation. It will then ask, is this RSS program a journal club? I do not have a journal club, so I selected no. But had I had a journal club, I select yes. And it is providing me with that journal club worksheet that we discussed earlier. Here you are able to upload your final and complete version of your journal club worksheet for the year. Again, this is not a journal club, my program, so I select no, and I can go ahead and submit my survey. And it says, thank you so much for submitting your 12-month follow-up evaluation. It is approximately 45 days before the 1-year mark of hosting my RSS program. I've received an invitation to submit content review and any updated information required in order to run my 2nd year of my RSS program. If I do not submit this to completion and get it approved, that means I can no longer run my RSS series for the 2nd year. The C&E team from that point forward, if this is not done, will not process any follow-up applications for your sessions and any rosters for your program. So in this case, I do want to run my series for an extra year up until its current expiration date. So I have clicked on the link to submit all of the needed information. At the top of the page, you'll see general program information. It will then ask me to upload the tentative schedule for the RSS program for this upcoming year. I do have that tentative schedule, so I've attached it to the application. Again, this is tentative, so if these dates change, that is okay. It will then ask, have there been any changes in the professional practice gaps for this program? You will then see below your current gap statement that you submitted in your original application will be there. If any changes need to be made, you will select yes, and you will see that you are provided a new box to submit your practice gap statement. In my case, this is a test program, so I'm going to select no. Have there been any changes in your objectives for this program? Again, you will see the current objectives for the program that you submitted a year ago. In this case, I am leaving it the same, but again, if I needed to provide new objectives for this upcoming year, I have the opportunity to do so if I select yes. The next part of this will not populate for everybody. If you had a non-clinical RSS program, you are not required to upload any disclosure forms or information. So this will not populate for you. Because my program was designated as clinical, all of this required disclosures are requested. So it says, please upload new disclosure forms for all course directors, planners, and coordinators for this program. If the individual is no longer a part of the program, you can leave their upload blank. So there is a copy of the disclosure form in case you need it to distribute to all of the individuals who need to submit a new disclosure form for the next year. And then it provides you a spot for each person that you included in that pre-application. So this is pulling from that original application, my name and my credentials, and it's allowing me a spot to upload my new disclosure. Whoever you included in that application will populate here for you to upload their new disclosure. It will then ask, do you need to add any additional individuals to this program? So in my case, I do have to add 2 new planners for this upcoming year. So it asks below to upload how many individuals do you need to add? In my case, I need to add the 2. So I have selected 2 and it provided me with 2 upload fields for those 2 additional disclosures. Now at the bottom, it states if you were required to upload disclosures and left a disclosure upload blank due to the individual no longer being a part of the program, please indicate that here so we know why there is an upload missing. So let's pretend that Jane Doe, Dr. Jane Doe, was a planner in this activity previously. There was a disclosure upload spot for her up at the top that I have left blank because she is no longer a part of the series going forward. So I left it blank. We want you to note that here so that whoever is reviewing and approving this content review and updated information form, that they understand why there is a disclosure form missing because it is no longer needed for that individual. So I've completed everything that I need to, and I hit submit, and it states, thank you for submitting the content review and updated information survey. The CNA team will review the documentation and let me know once it has been approved. So during the second year of your RSS program, you are still required to submit a 6-month follow-up evaluation and a 12-month follow-up evaluation. You will be automatically invited to submit this information just as you were for the first year. And if you look at the screen, you will see it looks very similar to how the first year looks. Also, keep in mind that if you did want to continue running your RSS program past the 2 years, joint accreditation only allows us to approve these programs for 2 years' time. So you will have to reapply from start to finish for your RSS program at this point in time. We do suggest that you keep that requirement of starting your application at least 60 days before your next start date of your RSS program. If you have any questions or need further clarification on this, please reach out to nursing conferences at northwell.edu and we will be more than happy to answer your questions.